Welcome to the Group Dentistry Now show, the voice of the DSO industry. Kim Larson and Bill Newman talk to industry leaders about their challenges, successes, and the future of group dentistry. Visit groupdentistrynow.com for more DSO analysis, news, and events. Looking for a job or have a job to fill? Visit joindso.com. We hope you enjoy today's show.
Hi, and welcome everyone to the Group Dentistry Now show. I'm Bill Newman, and we appreciate everybody listening and watching us today here. We have some special guests, as we always have, but we actually have Apex Dental Partners. We have two people from Apex Dental Partners here today, and they were on our 2019 Emerging Groups to Watch list. So we're actually going to drop a link to that in the show notes so you can read that entire article. But we're going to find out kind of where they are now and get a little bit of background on what they're up to, kind of their thoughts on the industry. And then we also would like to thank Ryan Murdock and Garrison Dental Solutions for being here and sponsoring this podcast. So we have David Lohmann, who is the CEO of Apex Dental Partners. Hi, David. Thanks for being here today.
Hi, Bill. Thanks for having us.
And we also have Dr. Michael Fooshee, and he is let me get this right because this is a little bit different he is the Chief Clinical Operations Officer. I think I got that right for Apex Dental Partners.
Yeah, thanks for having us, Bill.
Yeah, great. And Ryan Murdock, of course, is here, and he is the National Special Markets Sales Manager of Garrison Dental Solutions.
Thanks, Bill.
Yeah, great. So what I'll do is make it easy on myself is I'm going to let David and Dr. Fooshee introduce themselves, a little bit about their background, talk a little bit about Apex, and then we'll dive a little bit deeper there, and then we'll let Ryan as well. So David, why don't we let you start things off? Give us a little bit about your background.
Yeah, so my background, is actually in finance. My introduction into the dental industry through my wife, who's a general dentist. And really, we've built Apex around her experience coming out of school. She joined a group practice straight out of school, had a wonderful experience, but, the setting itself was maybe different than she envisioned. And we really, founded Apex in 2014, several years after she came out of school, with really the vision of building something that melded both worlds perfectly. So it's the values of private practice with the resources and the support of a much larger dental organization. So as I said, we founded Apex in 2014. We're Texas-based, and we pursue a non-branded affiliations-based business model. We kind of gravitate towards larger, more mature dental practices. And as you said, we made your emerging groups list in 2019 and have continued to grow. So today we support about 50 doctors across Texas, Oklahoma, and Colorado.
Okay, and out of those, so those 50 doctors, how many locations do you support?
We're about 30 locations today.
30 locations. Okay, great. And your background, as I read your bio here, you're investment professional. You had investment banking experience at Morgan Stanley.
That's right. I started my career in investment banking, spent a few years in an investing role before ultimately founding Apex.
Excellent. All right. And let's talk to Dr. Fooshee. And he obviously is a clinician but has a much bigger role than just a clinician at Apex. So talk a little bit about your background, if you don't mind, and then your role at Apex.
Yeah, certainly. So I went to dental school at the University of Oklahoma College of Dentistry from a family of dentists. So I've been in the field for a lot of years. Since I got out of dental school, I've really been in a wide range of dental practice models. And really what brought me to Apex was my passion for building organizations, specifically ones that keep providers and patients at the forefront. So really trying to protect that private practice experience for everyone. So here at Apex, I'm the Chief Clinical Operations Officer, really focus on leading the clinical operations team and also supporting our doctors across all of our practices, leading any organic growth initiatives as well. So it's keeping me busy. It's been exciting since I've joined here. I've known Dr. Lohmann for a long time, and certainly she shares a lot of the same values that I do as far as creating an organization and a patient experience that's really focuses on that private practice feel.
Dr. Fooshee, let me just ask this question. So in your role, are you involved in choosing or helping understand what products would make the most sense for the clinicians there, education? What things are you doing there to help support the practices and the doctors?
Right. So, from a doctor support perspective, it's really creating opportunities for education. It's making sure that they've got the resources they need. I think COVID was a really unique year because a lot of our doctors were struggling to get the CE that they had typically been able to get from some of the larger events. And so, yes, part of my role here was to be able to provide more opportunities for them to get those CE credits that they need. From a product perspective, we really take the approach that those are clinical decisions that we want the doctors to make at the practice level. And so really, my role is to make sure that we have the partnerships with different suppliers that make sense for our practices and our doctors, and providing that support and kind of facilitating the conversation between our practices and groups like Garrison.
Great. That leads us to Ryan Murdock, and Ryan's with Garrison Dental Solutions, and Ryan actually has an interesting background. So he's worked with Aspen Dental, worked for Aspen Dental, and D4C, and another DSO I'm blanking out on right now, but Cool Smiles, yeah, Benevis. So talk a little bit about that, Ryan, and your background, and then I'd love to kind of talk after that. Maybe you can talk about Garrison, but most importantly, talk about the partnership that you have with Apex. And I think that leads right into what Dr. Fooshee was talking about with continuing ed and educating the clinicians.
Yeah, like you mentioned, I have a little bit of a unique background, somewhat of an anomaly when it comes to the product manufacturing world. I started out in 2006 with Cool Smiles many years ago as a doctor and doctor specialist recruiter with the DSO environment. And then I went from there to Aspen Dental, where I was for close to 8 years, and then kind of a short stint with D4C. And it was all pretty focused on either general dentist or specialist recruitment, and a lot of time at dental schools and residency programs, sort of recruiting at that level, as well as bringing a lot of brand awareness about the DSO space to the students for much of that career. So my vantage point, or my lens of the dental industry, is pretty exclusively in the special markets field. So that's really how I know or came to learn dentistry, which was why I wanted to sort of transition that into the product manufacturing world, into the special markets segments of that product manufacturing world, because I think I could bring a lot of value to prospects and customers, just understanding kind of their pain points and being able to look at it through their eyes a little bit better because of that background that I had all those years in the DSO space. So it was really a career motivator for me to shift over to the product manufacturing world and really be able to try to help out a broader spectrum of groups, small groups all the way up to the big guys.
Yeah, it's not often that you have somebody on the manufacturer side of things that has actually worked for DSO for a while, and recruitment certainly has to be one of the tougher challenges, I think, for DSOs is. So I feel for you there. It's probably even more difficult now, so maybe it's a good reason that you're not there, but it's going to be one of the biggest challenges today is recruitment.
Yeah, I think doctor recruitment is and probably always has been the elephant in the room for sure.
Yeah. Well, good. So talk a little bit about Garrison, and I know that you've had a couple of new product launches this year in particular. So I'd love to talk about that, and then maybe transition that into, how you're really partnering with Apex.
Yeah, so Garrison was founded in 1996 by Dr. Edgar Garrison and his son, right out of their dental practice in Spring Lake, Michigan. They saw a challenge and a solution that needed to be developed, in particular in sectional matrix systems. So they developed the composite sectional matrix system years ago, 96, in the practice. And then it's built from that early ring system to what we now have, a fairly advanced sectional system and a pretty wide offering related to, matrices. That was probably the foundation of it, was the composite sectional, but we have a lot of auxiliary products that also have developed, and it's usually developed through clinician feedback. Primarily, we get a lot of feedback from customers in the field, and we sort of will develop products based on some of that feedback through them and our key opinion leaders. We're real excited this year. We've launched 2 products that are already quite popular. The first one was our sub-G fit strip system, and the Fusion Interior Matrix system just launched in March, and it's incredibly popular already. It's a very unique system when it comes to interior restorations. It's a metal band with a wedge, very similar to our basics in the composite systems, but it's applied to the interior cases. So really focused on those social 6. And it's already doing really well right out of the gate. And we're real excited about that prospect this year.
Great. And I think the one thing I'll just tie into this, which is coming from the dental manufacturing space as well as when you think of matrix bands and it's amazing how big a business it is. And, Garrison is actually a large company. You're on every continent, right?
Yeah.
So it always just fascinated me that it's very, very big business, and it's also technique sensitive. So, talk a little bit about that. COVID hits, trying to educate groups that have multiple practices across multiple states. What are you doing to help out, Apex and some of the other groups? What are some solutions that you use?
That's a great point, because our system is quite technically advanced to some degree. So it does require a little bit of education. If it's someone that's used an older system, a Toffelmeyer or whatever, that is looking to transition into a sectional matrix system, there's a lot of education and technique support that needs to go on in that regard. Or if it's somebody that's been using a system and wants to try a new one, or even someone that's accustomed to a Garrison system, it's always nice to be able to offer these groups and the doctors and the assistants in that group some additional training and support. And we've got a few avenues we can take, both from like a new customer onboarding process or an existing customer, continuing education. And then like what we did with Apex, I think it was in January or December, we did a hands-on course with them, which was a little bit more involved, where we sent product to the offices, and they did, it was through Zoom. It was a video CE course, but we did a pretty extensive hands-on course with their doctors and assistants, with one of our key opinion leaders helping out in that process, to really dig in and get real granular in that CE with those guys. It's just something that they wanted to do. I do have a CE course that's more of a basic and advanced sectional matrix course, but I can do it for any one of our product lines. We have CE offerings from everything from the fit strips on to the sectionals.
Dr. Fooshee, I'm kind of curious because, when Ryan talked a little bit about this hands-on through Zoom, I thought that was pretty unique. I mean, is it something that Apex has done in the past, or was it really kind of COVID driven? And what were your thoughts on how it went?
Yeah, great question. So the hands-on approach was COVID driven. And I think Ryan knew that we had a large number of our doctors already using Garrison's products, but like most things in dentistry, the technology and techniques change over time. And so, I think the approach that Ryan had offered was exactly right in what we needed, because you'd mentioned, use of the sectional matrix system is technique sensitive, and certainly the hands-on part, I think, is super important for doctors just to feel comfortable using it. And we also offered our assistants as well to get that CE. And so, I think it went really great. I think everybody by then was really tired of just doing, a Zoom CE where they're, sitting there at home. We had these in the practice where the doctors, went ahead and used hand pieces and polished and did all those things. So it really felt more like a, typical CE environment where you're actually going to, use product, get a feel for how it would work in the mouth, work with your assistant in a hands-on capacity so that they understand how the sectional matrix works as well. And so, I think it was, a big hit after, a very long time for our team to not have access to that hands-on component.
Excellent. Now, I'm going to ask David this question. As far as, you're talking to clinicians that may be looking to partner with Apex. I mean, what are you hearing things from them as far as access to education? What do you hear? And I'm kind of curious, especially with COVID, have you seen an increase in inquiries? You often hear these maybe docs kind of seeking shelter from the next storm, right? So we had, the Great Recession in 2008, and you kind of just get through that. Your everything's kind of back up to maybe where it was pre 2008 as far as your retirement account, and then this, COVID hits, and do you really want to go through whatever next is, right? So I'm curious.
Yeah, it's been a really interesting time for Apex, and I suspect other groups out there that you were faced with this really unique challenge that was the pandemic, and at the same time, we experienced quite a bit of growth over the last year as an organization. You did have these doctors who, I think for the first time were kind of faced with this reality that there is risk in the world. So many dentists have the overwhelming majority of their personal wealth tied up in their practice. And, when confronted with this really unique challenge, I think it caused a lot of people to, at least at minimum, begin exploring options out there. You asked earlier in the question about what are doctors looking for? This is where I think that this partnership with Garrison and their flexibility to really tailor something that fit us was so unique and important for other groups of our size. Those groups in the 20 to 50 practices, call it, that, you're of a scale where your doctors are actually starting to look to you for more of these educational opportunities, for you to bring ideas to them. And yet you're still not at a scale where you're throwing a major conference just for your doctors in Las Vegas, call it. So the ability for Ryan and Garrison to kind of step up to the plate, tailor something that met our doctors' needs and the organization's needs more broadly was, really, really appreciated at that time.
That's great. I'll ask this to Dr. Fooshee and also David. As I was kind of looking through some of the information that was provided ahead of time, talk to me a little bit about this. This is interesting. Is private practice reimagined? So, I know that probably there's concern when somebody is affiliating, partnering with a DSO, that they're going to lose their autonomy. Dr. Fooshee talked about this. We leave it up to the clinicians what products they use and can choose. But I think there's a lot of apprehension going in that I'm not going to be able to use the lab I want to use. I'm not going to be able to use the products I want to use. So is that what private practice reimagined is? Talk a little bit about that.
Yeah, it really is. And again, I talked about this was kind of the model from the beginning, and it was to build an organization that melded that historically private practice experience for doctors, for staff, for patients with the resources of a larger organization. And, what we mean by that private practice reimagined is it's really staying true to those values. It's got to be a doctor-centric organization that we're building. We believe strongly that dentistry must remain extremely relationship oriented between that doctor and that patient. And it's really Apex supporting that doctor to practice the way that they believe is right. I think the most exciting thing about dentistry right now, Bill, and you have, groups on your podcast all the time, is that there are so many models out there that there is an option for every dentist. And regardless of your geographic location, your practice size, your payer mix. And, the one thing that we've done at Apex is just stay very true to our model. Yes, we've experienced growth, but it's really been focused around growing around the right people, the right practices that we think we can be successful with, and in turn support their success. So again, back to your question, that's kind of what that private practice reimagined means to us.
Yeah, that's great. Dr. Fooshee, I don't know if you have anything you want to add to that.
Yeah, I come from a mixture of experiences, both in the small boutique fee-for-service private practice world, as well as a larger branded organization prior to coming and working with Apex. So I understand all the values from a support side that DSOs can provide. I also understand what the typical private practice owner is really looking for and wanting to protect in their practice. And I think that's really what dentists, turn to us. They turn to us when they're looking for, a partner that can really protect that private practice feel and experience. And really, our focus is from a, kind of ask the question about supplies use and materials and labs. We look at all those decisions as clinical decisions that, our doctors have the autonomy to certainly make those decisions. So just from our approach is to continue to protect that private practice patient experience, private practice experience for the team and the doctor, and really continue to protect that, for years to come. So
excellent. So Ryan, what's your experience? What are you seeing with some other groups out there as far as the need for continuing education and just because you get to see a lot, so you see what Apex is doing. They've kind of talked a little bit about things, and I will say that it's great. You explain your model really well. It's got to be a challenge if if you're looking to maybe possibly affiliate. Everybody has different models now. It's like you can't. Used to be there were maybe 3 or 4 different models, and now there's iterations of about maybe 20. So it's got to be a daunting task. So.
Yeah, that's actually a really good question. I think sometimes the larger the group, the harder it might be for us to implement some of these CE offerings, just because they may offer a lot internally. They just may not have the need. They're getting inundated with so much. So the smaller, the emerging groups are really a good wheelhouse for us regarding the CE offerings or even the hands-on portions, just because they're smaller groups that may get neglected a little bit, or not full on neglected, but somewhere in that type of range where they're being overlooked sometimes. So I like to spend some focus on obviously my large group customers and prospects, but I like those mid-tier, small and emerging groups, just because I think that I have a little bit more access to both them and their doctors to really dig in and help at that technical level that sometimes may get lost with the larger groups. I can still run these programs with larger groups. It just sort of depends on the group sometimes. But a group like Apex and in that size bracket is a real good fit for a lot of reasons. It's just far more interactive type of courses, just a lot more responsiveness out of the groups, before, during, and after the program. So I think they tend to maybe get a little bit more out of it than when there's a huge amount of people on a virtual CE. If you can kind of winnow it down to have 20, 30 or so doctors per course is a little bit more beneficial for everyone.
Yeah, great point. Dr. Fooshee, I'll ask you this. What products and technology do you see out there? What are you excited about? What do you want to find out more? I mean, it seems like everything's AI now, right? Whatever that means. but
right.
So that may be one thing that you're excited about. But even on the clinical side, I'm kind of curious what you see out there that maybe has you and the clinicians excited.
Yeah, I mean, I think the trend in digital dentistry is finally becoming considered the norm, and really, I think that trend has been a long time coming. I mean, we've had, access to digital scanners for restorative for many, many years now, but, I've really been excited by just the quality of the scanners that are out there, and also the uptake and use from doctors, just in the past, I'd call it, 5 to 10 years. So I think that's, an area that's going to continue to grow, and it's going to continue to also lead to better patient outcomes, better patient experiences. I think, yes, the AI is interesting. I think especially for larger organizations, they're, really looking for, quality assurance and ensuring that, we're providing the best standard of care for all of our patients. I think it's constantly changing environment. So I'm sure there'll be a lot more changes in the coming years that we don't even realize are coming yet. But it's definitely an exciting time in dentistry.
Yeah, it certainly is. So Ryan, let's talk about some of these new products. So you have 2 new products out, right? So let's talk a little bit about those. And
yeah, I've got the Sub-G Fit Strip, which is sort of a spinoff of our Fit Strip IPR systems. That's quite popular, especially if you're doing clear aligners or Invisalign cases for your interproximal reduction. The Sub-G one is more of for your cleanup processes to knock away some of the overhangs at a Sub-G level, but it's really a spinoff of the IPR Fit Strip system that's been real popular for a few years. And then our interior Fusion matrix system is also kind of a spinoff and comes from clinician feedback. We had some clinicians that were actually taking our metal bands for posterior restorations and turning them sideways and sort of creating their own little metal band and working with it that way because they didn't like the Mylar system for anteriors. So they kind of created their own little back door, if you will, to get around that. And we built off of that. And it's a nice little metal band, comes with a wedge similar to the posterior system. It takes away the need for 3 or 4 hands to do a Mylar anterior restoration, and you can kind of do it with one set of hands, and just speeds up the process there in the chair. It's really, really popular already, and it's only been out since March. And it's definitely one of the top products so far this year.
Oh, yeah, that's exciting. And I mean, I definitely can relate. It seems like dentists always can repurpose products out there for, it's their special technique, or if there isn't a product that has been created yet, right? Yeah. So I'm sure you probably have that going on at Apex as well, where, there's that, it's kind of interesting because you have, clinicians, so you're a doctor, but you're also, an artist and a craftsman, kind of all combined. Yeah, interesting. So let's talk a little bit about Ryan, and then we'll talk to Dr. Fooshee and David about this. So on the education side of things, maybe you could talk about this, Ryan. You talked about hands-on, so it's kind of a combination, right? It's virtual, but they're doing the hands-on there as well. And then we're going to start to see more in-person opportunities for CE. I mean, what's Garrison seeing now? Are you going to start to do more of those?
That's a good point, because what we did with Apex, ideally, I would have preferred to do that in person, in the old world, for lack of a better term. I would have rather have done that in person, but oddly enough, it went really well virtually. It was, we had a key opinion leader come in there. It was quite interactive. You kind of lose some of that interpersonal, relationship development when you're doing it virtually, but that is what it is, at least for the last year. So there were some benefits to kind of that virtual hands-on, because they could interact with us over the video and the like you could do in person. And the other nice part was it's a little bit easier to record those courses, the same as our other CE courses, where we'll record that course and I'll send the follow-up recording out to the leadership team and the other doctors, that whoever participates in it, so that they could watch it at their leisure. Or if somebody missed the course, they could watch it, whenever they had some time. We do the same thing for our basic and advanced, courses as well that are over webinar formats. We'll record that and send those videos out too. So it's just another way to hang on to a tool. You can revert back to it if you need a little bit, of a recap of the course, or if you are struggling somewhere in a case, you could watch the video and fast forward to the part you needed to pay a little bit more attention on at a later date.
Yeah, that's great. Dr. Fooshee, what do you see? I mean, do your clinicians, or do you feel that they want to get out and do more hands-on? And kind of to Ryan's point, you do, maybe you can't certainly ask all the questions you may want. You do lose some perspective with hands-on. If you can't actually, you lose the 3D, right? So you don't have that as well. So what are you looking forward to towards the end of this year?
Yeah, I think that was perfect for the time, but I 100% agree with Ryan that in general, our doctors really do enjoy that ability to be in person with other doctors and collaborate, because those one-off conversations with the instructor or other clinicians that have another technique or another approach that they'd use, you just lose out on some of that virtually. I think we'll see a continued increased acceptance of virtual options, but I know that probably I would assume over the next year, as people are getting more opportunities to go to in-person CE events. We're hosting our first company-wide here in June. So I think we're going to see more of that trend towards in-person CE, just because people are ready for it. And like I said, it's a really great opportunity from our perspective to continue to build culture and build relationships with between doctors and with our doctors. And we're in a relationship business, and we focus really heavily on that, and it's tough to do virtually. So we are looking forward to those opportunities through the end of the year to really connect with our team members and our clinicians. And I know they're looking for that same thing between each other. So we're excited about the shift that I think is going to occur for most groups through the end of the year.
Yeah, and I mean that's great point about culture. David, talk a little bit about that. Has it been difficult over the COVID to really kind of keep that culture going and communication and just I think keep people's spirits up?
Yeah, and I think it's a great point, because I think culture is perhaps one of the most difficult challenges that any growing group faces. We're in a multi-location business by nature of how group dentistry works. Each location has a relatively small number of team and doctors there. And how do you kind of meld the uniqueness of that practice with the overall culture and just philosophy of the larger group? We talked about it. Doctors are joining groups for a reason. They want to be part of something bigger. They want the benefits that come with that. And I think overall culture is a big component of that. So, literally during the shutdown, we made a big push towards digital. All of our teams were at home. We started doing company-wide Zoom town halls. It was really about staying in front of our team, letting them know what we were working on behind the scenes, letting them know that they were at the forefront of all the decisions we were making to, in our case, we kept all of our teams employed, and really wanted to be there for them for that. We have continued that even as we have reopened. And as Michael said, I think it's going to be part of the way that, both dentistry and I think, companies more broadly across industries interact with their teams, interact with each other. But there really is no replacement for that in-person culture building opportunity.
Yeah, and it sounds like you're going to have something coming up in June. You're going to bring all the stakeholders in from the different practices and get together in Dallas. Is that the idea?
We are, since we're spread kind of across, we're actually doing 3 locations. So breaking it into still relatively small. We'd love one central group, but we made the kind of company-wide decision that, hey, let's at least be responsible and try to keep these somewhat isolated for the time being. But 3 locations, one in Houston, one in DFW, and then one in Oklahoma City, where kind of all surrounding practices and truly the entire team, assistants, hygienists, front office, and doctors are coming together for, centered around a CE opportunity. But the bigger emphasis is really on reconnecting people after, 15 months of what's been isolation and really driving that culture component back home.
Yeah, that's a great idea. I mean, I think everybody's ready for it. So,
yeah.
All right. So I've got one last question here. I kind of always ask my guests to kind of take out their crystal ball and give me a little perspective on, what you see the future of the industry. And so I'll start with Ryan. So what are you thinking from maybe the manufacturer side, and then of course your customers, the DSOs? What are you anticipating in whatever 3 months, a year?
Yeah, I mean, I'm really excited about the prospect of getting back to some semblance of normalcy, because as we all just spoke about to some degree, it's a very personal industry at its core, I think. And I think that's what I've always liked the most about being in the dental industry, in particular the DSO space. But dentistry as a whole is a very personal, both at the clinical level, all the way up from the manufacturing partnerships, the dealer relationships, all those things. It's a very personal environment. And I kind of miss that personally. And I think that that's going to bring a lot of high hopes for the future, is kind of opening those avenues of those interpersonal meetings and that type of relationship development, which kind of has gone by the wayside, I feel like, to some degree in the last 12, 15 months. And I just think that there's a huge eagerness waiting in the wings for that sense of normalcy and that personal relationship piece of the dental industry to get back to normal. Garrison as a whole, we've got a lot of high hopes with these new product launches. We try to launch, 2-3 new products a year and continue to innovate the lines that we have right now. So I think just personally at the Garrison level, there's a lot of high hopes there. And me in particular, in the segment that I support, the special markets and the DSO worlds, I've been in the DSO space 15 years. I've seen it grow from Aspen Dental at 90 locations when I started in 2009 there. And now I think they've got, 900 locations. So just that segment of the industry is really exciting in general. And I think continuing to watch it do what it's doing gives me a lot of personal and professional high hopes.
Yeah, that's great. So Dr. Fooshee and David, I'll let you kind of give a little perspective on, you know, where's Apex going? I'm sure you've got a business plan laid out, and whether it's, you know, moving beyond the geography you're in, or, you know, maybe doing a little bit more within the geography. What's, you know, kind of what are your thoughts? And then maybe what are your thoughts on the industry as it continues to consolidate? You know, are there any pitfalls potentially with the consolidation that's going on? So Dr. Fooshee, if you want to start things off.
Yeah, you know, I'll kind of speak to maybe the clinician's perspective on the future of dentistry. You know, I've grown up in the dental field and experienced, you know, different types of practice models. But, you know, really, I think all these changes that have occurred and kind of the growth of group dentistry, I think I really view as positive overall for providing more diverse opportunities for clinicians really at any point in their career, which I think is great for the profession. You know, I think for young doctors specifically, there's more options than ever as they come out of dental school. And, you know, I know that there's different challenges that younger clinicians are facing now than they may have faced 30 years ago. And, you know, it's debt related and such. But, you know, I think that the types of practice opportunities they have now and just the number of options they have, you know, really is great for clinicians and the profession overall. And I think there's talk of, you know, a shift in what dentists are looking for as well as they graduate, whether it's, you know, looking for more of that work-life balance and flexibility. So, you know, I think, you know, those trends fit really well with, you know, the opportunities that are being created with group dentistry. And, you know, I think that, you know, we'll continue to see, you know, just more opportunities for clinicians and really, we were talking earlier about just all the different types of, you know, ways of being a group in the dental space. And I think that there's more options for doctors than ever before, which I think overall is great for the industry.
Absolutely. David?
Yeah, I'd echo that. I would say that both as an organization in Apex and as an industry overall, I think we're extremely bullish on what the future looks like. You know, at Apex, yes, we have growth plans. I mean, that's probably no secret. You know, we expect significant growth this year, both within our existing markets and even looking at additional state expansion. You know, I think what the Apex model is resonating really well with dentists today, and we're excited to grow around great people. But I think the industry more broadly is at such an exciting, I say inflection point, but it seems like each year, you know, that just kind of moving the goalpost down the road. You know, the way that we've always thought about it and talked about it is for, you know, the last century, it seems like dentistry has always kind of lagged the physician side of healthcare more broadly. And I think that gap is closing so rapidly with the, you know, evolution of in technology, in marketing kind of initiatives, and in ways to connect with your patient. And then on the group practice side, I mean, I mentioned it earlier, that side of the industry has evolved so much just in the last, you know, 10 years, certainly, but even 5 years, to where there's so many unique models out there. There's truly a solution for any dentist looking for, you know, the support of a larger organization. And I think that's really exciting. You know, finally, I'll say that you look at how dentistry performed through the pandemic, how it bounced back. You know, if that doesn't get you excited and confident in the future of dentistry, I don't know what will. So, you know, like I said, myself as an organization, we're extremely excited about where dentistry is going.
I think that's a great point to end things on. Is there were dire predictions, right, at the beginning of COVID, and some numbers like the dentistry production in North America would be halved, right? It would be in half, and fortunately we didn't go that route. But that was what I had heard early on from a couple of different people that didn't know what they were talking about. So I think you're right. The way we bounce back and makes me feel pretty confident that yeah, we're in a good industry, and consolidation is exciting and dynamic. And I feel like every week there's a new story of somebody coming into the space and somebody being acquired. And I think as long as they're providing, quality care to the patients and also supporting the clinicians, we're on a good track here. So, all right, I think we'll end things on that. I appreciate David Lohmann from Apex Dental Partners and Dr. Michael Fooshee from Apex Dental Partners. And thank you, Ryan and Garrison Dental Solutions for sponsoring this. I appreciate everybody being here on the Group Dentistry Now show today. It's been a lot of fun, and we'll hope to have you all back sometime soon.
Great. Thanks, Bill.
Sounds great.
Thank you, Bill.
Yep.
Thank
Thank
you
you.
all.
Until next time, I'm Bill Newman, and this is the Group Dentistry Now show.
The Group Dentistry Now show has listeners across North and South America, Europe, Asia, and Australia. If you like our show, subscribe today, and please tell your colleagues about us.